Bangkok needed.
기술력 맛.
Those are what you see articulates are going into the
Сайн хүн үзэгчтэй. Өнөөдөр манай дефактоны нэвтрүүлгийн зочноор Дэлхийн Зөн Монгол байгууллагын Монголыг хариуцсан захирал нь ноён Vincent Edwards оролцож байна. Good evening, sir.
Thank you. Good evening.
You have been working for quite some time for world vision in general, and in a certain time, quite some time for Mongolia. Please, how you have started to work, and when you start to work in Mongolia.
Good, thank you. I'm working for World Vision for the past 33 years. I started working for World Vision from India way back in 1982.
Where you are from, actually?
I'm actually from India.
Yes.
And I come from a city in India called Bangalore, I think, which many Mongolians know. And a lot of them go there for education. So at the age of probably around 22 is when I was really fascinated by the work that World Vision does, particularly with the most vulnerable and the most needy children and families. So I opted immediately after doing a little bit of college to go and join up with World Vision. And my journey started with World Vision in India.
And you have been posted to several other countries
Yes.
before Mongolia. Which country? Mozambique? What other countries?
Okay. Well, I worked in India for 9 years, basically in the area of emergency relief and rehabilitation. And there's not a disaster in India, major disaster in India, that I've not participated, for World Vision. And I had an opportunity in 1990 to go international. And Mozambique at that stage was still under war, and they had needed people to take care of some of the internally displaced people. When there's fighting going on, that people get displaced. They have to leave their homes and leave.
Mozambique.
So there was a lot of internally displaced people, almost close to 245,000 of those people that lived. So they were needing hands, to go, and I was very excited because for me, always making a difference in the life of people was very, very important to me.
And you went to other countries?
Yes.
Cambodia.
So in Mozambique, I was there for close to a year. Then I went to Malawi in 1992, again leading a major food program there. And in 93, I moved to Angola. And again, Angola was a country that was very much in need. Same story, internally displaced people, the war going on, and World Vision had just started a program. And basically, I was part of the initial team that set up the program, and the program grew. And I left Angola in 1997, so 4 years I was in Angola. And then I moved to the Philippines because I think our children needed to go to a school, because taking them along with me in countries where there was this war and the situations with insecurity was not a good thing for families. I'm sure you'll know that. So my wife and I thought that it's better that we try to move to a more stable place. And we moved to the Philippines. And in the Philippines, I had a regional role as a regional director for relief, right from Sri Lanka up to Papua New Guinea, the PDG group. So all the countries that World Vision worked there, almost 17 countries, I was responsible for all emergency work that World Vision did. And then I was there for 8 years, which was a very good time, I must say, in terms of family stability and my children going to an international school in Manila. Then I moved to Bangladesh as the country director for Bangladesh in 2005. And there again, challenges with Bangladesh. Many of you know about the issues of poverty.
You have been during Aceh, Indonesia, 2004?
Yes, the tsunami. Yes, I initially for about 6 months headed the tsunami response for India, Indonesia, Sri Lanka, and a little bit of Thailand too. I initially headed up for 6 months, but since they had already nominated me for Bangladesh, they knew that they needed a long-term leadership. So they immediately after 6 months, we got somebody to head the tsunami response. That was a major response for World Vision, and I know many other agencies.
It was a major signal for the world
Yes.
how we are altogether not ready for this sort of natural disaster.
Absolutely. I agree.
Particularly the countries that have ocean.
Yes.
And then
And of course,
Bangladesh.
Yeah, Bangladesh was there for 5 years. Again, a very challenging program in terms of the needs and what World Vision can do in terms of the different areas that we work with health, education, and economic development. So I moved from Bangladesh in 2010 to Mongolia.
Well, okay, so you have been working for Mongolia almost 6 years.
Yes.
And now I understand you are leaving soon. And you have been working all these countries, including Mongolia. And World Vision is dealing with helping people, in particular children, to overcome the issues they face in the society like these countries. And let's talk one by one the issues in Mongolia. But before we go, let me make clear that World Vision is organizations. It's actually one of the largest UN partner organizations, right? When issues come to sort of disaster relief, World Vision is like one of the largest organizations. So please tell us a few words about the organizations. Who are you? Where are you based? Who is financing? And what are you doing?
Okay, thank you. Well, World Vision has been in Mongolia since 1995. We actually started in 1993 with a response to the Zood in Govi Altai.
I remember.
And then immediately after that response, in 1995, we opened up our office in Ulaanbaatar. And since then, for the past 21 years, we've been working and steadily kind of our footprints is properly, pretty large. We're working in 17 AMACs and 7 districts of UB, and the way we work is, again, as an organization, we are child-focused. When I mean child-focused, what I mean is, as an organization, we are caring for the needs of children, particularly the most vulnerable children, within their own families and within the communities. So that is why around the world, for World Vision, working with children and protecting children and allowing children to participate in their own development and all issues concerning them is very, very important for us. And as a global organization, there are 4 major things that we really are looking for in every country that we work. We are at the moment working in over 97 countries around the world. And when I mean the 4 targets that we're looking at is, we want to ensure our donors and supporters, who are so many in the world, that our children that we support will be healthy and they will be protected from all diseases, that they will be educated for life. When I mean educated for life is that at age 11, that they will be able to read and write and comprehend what they do. And that they will be protected from abuse, from disease, and also that the children will be actively participating in their own development and participate in decisions concerning them. And I think that is what World Vision globally is kind of really looking at. And so even though we are child-focused, we work for children, we work within communities, because we know that if we have to strengthen families.
You told about 97 countries you are operating, and when the disaster relief needs, UN is working with you as a partner. So it's a quite recognition and also responsibility. So from that perspective, in particular from those 4, your mission, let's talk about Mongolia. So let's take, you said you're almost 20 years in Mongolia.
Yes.
Let's address these 20 years. What was the major problem 20 years ago in Mongolia for children from those perspective, and today? If you can say 1 to 3 priority for the children, what was the changes and problems?
Okay. Well, again, 20 years ago when World Vision came here, I'm sure the situation in Mongolia was not what it is today.
Yes, of course.
And definitely there was a lot of need for World Vision to work with the government in terms of building infrastructure. And when I meant, the 4 targets that we're talking about, so particularly, let's take the issue of health. Definitely in the area of health, there were a lot of needs, particularly for children. in the area of maybe nutrition, in the area of taking care of mother and child health issues, and then World Vision at that stage also was working with the government in terms of saying, how can we really improve the infrastructure? Maybe there were some health clinics that were put up. Maybe there was a lot of training, capacity building for some of the medical professionals that World Vision was involved in. And today, as we look at it, there are many things in the area of health that Mongolia has already achieved. And of course, there are some areas that they still need to focus on, and I think the SDGs and others will talk about that. But having said that,
if you take the last 20 years, statistically, our per capita income is almost 10 times increased. I don't say about the infrastructure development, the amount of cars, pollutions, everything altogether. But issues with children, how successfully this country is addressing or unsuccessfully, what are the challenges still remaining today?
Okay. Well, Jargal, actually, as Mongolia has grown economically strong, I think many of us know that. We also know the story of the GDP growth and how currently today, maybe the GDP is not as much as it was in 2012-13, we know that. But yet, I would say, we still have about 21.6% of the population that are below the poverty line. So when we are talking about families that are below the poverty line or in poverty, these are the families that World Vision will call is the most vulnerable.
Okay, let's talk a little bit details on that. Statistics say that this UN World Bank, I guess, statistics, it is per person per day $2.
Yes.
And if the family has a 5, then per day they have a less than $10 income as a family. And then the World Bank estimates that this family has a problem with covering minimum needs in terms of nutrition, right, first of all. And out of that, the children are the most vulnerable victims. And you have been yourself traveling all around Mongolia, many amaks, many districts. You have been visiting yourself poor families. What does it look like about living under $2 per day per person in the house?
Let me be frank, it is not really good. Some of the situations that I've seen, particularly with female-headed households with a lot of children, single mother households, disabled people, families with disabled children, people without work, it's very, very challenging for them to make their ends meet. And that's why I said, when we're talking about people that are below $2 a day, that's, in the context that we're talking today in Mongolia, with so much of inflation and the costs, that is definitely not going to get you anywhere. So these are the people that I would really see or say is most vulnerable. And definitely, they are struggling to make their ends meet. And as Mongolia is growing economically strong, the other thing that I've also seen, Jargal, is that the gap between the rich and the poor is getting more wider and wider. As Mongolia is growing economically strong, very good, but I do also see a gap, where 21% of the country's population, for a population of 3 million, number-wise may not be very big, but still, it's percentage-wise is like, percentage-wise is 1 in 5.
On the other hand, World Bank current office says that another 20 to 30% are almost ready to jump over that $2 per day line, which means basically half of the country can be potentially very poor. Is it? You agree with that statistics?
Well, I don't know about the percentage. What I can tell you is that in many, many contexts, there always exist population that are below the poverty line. In the case of Mongolia, maybe 21%. But if nothing is done for those that are above the poverty line or on the borderline, your statement and what World Bank and others would say, and we've seen this in the country, many, many countries around Asia Pacific and other places, there's a potential for those that are today okay to fall. And I think what we need to do, that's what the safety net programs that we need to really start working on, to see that those that currently today have a job, currently are able to send their children to school, currently are able to eat good food, if suddenly some shocks, economic shocks happen within their own households, there's a lot of potential for them to join down.
What's happening now, right now, in the terms of the economics downturn now, that unfortunately is happening. Okay, now let's having in mind that picture, let's go into the children's world in these houses. Of course, it's a matter of, relatively Mongolia has good access to schools, but it's a matter how many children in a school, how successful are the children from the poor family. What you would say in these terms?
Well, definitely there are some good stories from Mongolia. You know, coming from different countries that I mentioned that I worked with and traveled, and also working and talking to my colleagues around the world. You know, I said World Vision works in 97 countries. I know many of the directors that are working in many of these countries. Mongolia, in terms of its enrollment, we see over 95% of school enrollment, which is good. And again, even in terms of the literacy rate, we're talking something around 98%, which is pretty good. I think for World Vision, as we look at all these numbers, I think the focus for us is more in terms of, is the quality of education good? And is the access for education also there? You know, we are talking about good numbers. 95+% is very good compared to many countries that don't even come up.
Let's go to specifics after, but what I just trying to describe the situation of these children in terms of education. Now let's talk about the nutrition. In particular, I understand from your and UNICEF statistics that we have to pay attention to full nutrition, rational good nutrition of children up to 3 years and 6 years. Are we doing sufficient enough? Are our kids eating, at least getting these nutrition, these minerals, good enough?
Sure. Well, under 5 nutrition or malnutrition, you know, is also getting better every day. And I think World Vision, along with UNICEF, were working with sprinkles, the micronutrients, and how we were able to kind of really work with that. Today, if you really look at the aspect of nutrition, definitely Mongolia has gone above the WHO standards in terms of nutrition. So which means today we rejoice that there is sustainability in that area of aspect of nutrition.
So
and the
children are not starving?
Yes, children are not starving.
Not starving. Okay. But still, per 1,000 mother or just born baby, we have still mortality issues. And the mortality issues, just born babies, one issue, prematurely born, right? This is another statistics, and up to 5 years, another statistics of the children's death.
Well, I think one of the focus in the area of health in our current strategy from 16 to 18, we are talking about how we can, along with the government and our partners, UN partners and other partners, talk about child and mother morbidity rates to be really kind of reduced. I know that Mongolia is doing well compared to many other countries, but still I know that's an area that we can really work well to reduce the numbers to some very much acceptable levels in terms of how poverty and nutrition plays a major role in terms of adding up to this problem. So in that sense, I think definitely there is focus on that. And while we did talk about the aspect of nutrition, whereby with the government working and taking over this micronutrients today, the sprinkles program will be in many areas taken over by the government. So I think we can continue to work with all our partners in this and see how those rates and the numbers can definitely be dropped down, and definitely Mongolian mothers can have safe delivery, and the children can also be really protected. You can look at that.
Still per 1,000 live born babies, we have a lot losses. Why is that? Why it is not decreasing as much as you would like to see?
Well, I think definitely one is in terms of how we can improve the healthcare is an aspect. Definitely we do see, while in the city and other places, we do have a lot of health services. Of course, in the Gare districts, because of all this big migration, there's always a stress. definitely in the rural areas, there is a lot of scope for us to improve, the primary health services. And also in terms of how World Vision and all its partners can definitely, work with the mothers, in terms of really taking care of the, all the care before giving birth, and also really equipping them. I saw the other day statistics about a lot of adolescent mothers too, like almost about close to 4% of young mothers, adolescent mothers. So how do we work with the various agencies, particularly also with the government, in preparing them to know, what it means to really go through, the delivery and pregnancy and other things like that. So those are some aspects that we need to continue to work. Like I mentioned to you, one of our health strategies is definitely trying and seeing how infant mortality rates and mother morbidity rates, those can definitely be reduced.
Okay, let's discuss about this young mother, young adult mother, after this small break. Okay,
Yes,
thank you.
гişэлэг мат
That's what we've seen, particularly to going into the
Би рүүхийн шок харахгүйгээр 1 минутанд нийлүүлж 30 минутанд 1000 цифр тогтоодог. Энэ бол хичээл сургуулийн үр дүн. Аливаа өвдлийг олон дахин давтвал дадал зуршлуулдаг. Хуримч гэсэн үнэтэй адил. Тогтмол хуримтлуулж байж үр дүнд хүрнэ. Судалгаа хийж үзэхэд 2 сая орлоготой өрөх сар бүр 200 мянган төгрөг хуримтлуулах боломжтой байна. Ингэж хуримтлуулж чадвал 10 жилийн дараа 53 сая төгрөгтэй болсон. Тийм учраас хуримтлалыг зуршлуулах.
Үн дэсний хуримтлалын хөдөлгөөр.
Танд хэрэгтэй бүх үйлчилгээ нэг дор зогслоос. Дэлхийн брэндээр томилсон хансаг зэрэглэлийн орон сууцыг нэгээс 3 жилийн хугацаанд төлөвлөн өөрийн болгох таатай боломжийг зөвхөн бид сануулж байна.
Миний ертөнц, миний уран бүтээлийн минь тусгал.
King Tower Luxury Apartment.
гişэлэг мат
That's what we've seen, particularly to going into the
Just we talked about this primary care of pregnant mother, young adult woman. Here there are several issues if you break it down. One is compared with other countries, at least you have been working, or the statistics how is the ratio of this sort of very young mother in Mongolia?
Well, I think we need to look at this in a much bigger scope, right? Number one, if you look at some other countries that I worked, in South Asia Pacific, we can look at, definitely the primary health care is not as established as it is here. Definitely, I have personally visited some of the primary health cares, even in some of the Zooms of some of the AMAGs. I do see a lot of effort, and also in terms of some of the equipment and the knowledge that's been implanted in mothers that are aspiring to be, getting pregnant or are pregnant, in terms of really what it means to go through this, and also taking care of the proper nutrition. One of the things that World Vision has been working with the mothers is the PD Hearth model, where I talked to you about some time ago. And the PD Hearth model is basically trying to give mothers the knowledge about nutrition, and knowledge about nutrition which is available in their own backyard. What I mean by backyard is something locally available. We don't have to import anything. It's all available locally. And with some of those things, being taken as food and really supplementing it well, and it's more in terms of how additional nutrition is given.
What kind of?
Well, it could be like, for example, with milk products, even vegetables, some of the green leafy vegetables. Some of the mothers are taught, I visited some of the healthcare centers where they've been taught about how to prepare the food, how some of the nutrition aspects are so important for the mother and the children.
Okay, let's then put in that perspective. You have been to other developing countries, you have seen Mongolian cases, compare them. Where Mongolia have certain flaws, where we have to pay attention in terms of, say, primary health care, we call it house hospital or house service. We have this sort of unit in every horo in the city, and so on in the countryside. where structurally we have flaws, where we can improve?
Well, I think from a structural infrastructure point of view, definitely the demographics of Mongolia is challenging, isn't it? Sometimes, I've seen, primary health care centers at the SUM level, and I know even at the BAG level, sometimes, there's a lot of help that's needed. In terms of infrastructure, in terms of knowledge, I think we're getting there. I think Mongolia is getting there, and I think I have seen a lot of committed health professionals in some of the places that I've got. And to be frank with you, some of the numbers that they're talking about in terms of, death rates and all that, and even malnutrition rates are very, very low compared to, many, many countries that I've visited. So that's why I said, in one aspect, Mongolia has probably, in terms of nutrition, really come over the WHO levels. But definitely in terms of its awareness to the younger population particularly and all that, that's something that needs to continue to, because there's going to be a lot of young mothers and new mothers wanting to have children, and that's something that needs to continue, giving the awareness and seeing how, they can develop, a younger population, in many, many of these countries.
You have seen the problems, of course, because that's why you are here, to help to address the issues in Mongolia, and I understand your program is keep extending. You have how many Mongolian staff? What do you have?
We have at the moment close to 625 Mongolian staff.
In all
the 17 MAGs and the 7 districts in UB.
670 employees, Mongolian employees, as you are quite large employer, and of course these people's family also depend on you, and you have seen they are with you together, with your professionals together to address the many issues. Out of these issues you have been helping, what was the worst case that stays in your mind in Mongolia?
Well, I think for me, I really want to turn around and say what are some of the good things, the successes that I really feel, proud of before leaving, Mongolia. I did mention that World Vision is a child-focused organization.
I was going to ask you anyway, but okay,
yes.
Go ahead. Okay, first let's go with positive.
Yes. So for me, when I came into the country and to really see how World Vision for the past 20 years plus has been working so close with the government. In fact, we have such good relationships with most ministries that we work with, Ministry of Health, Education, Economic Development, definitely the Ministry of Population Development and Social Protection, where we work a lot. In terms of our relationships, we have been able to kind of really work closely in terms of how issues of children really are addressed, particularly child protection. And as a child-focused organization, for us working at the SUM level and the AMAG level, we are working in almost 105 SUMs, 47 horos, in the country. That's a large footprint. And
quite large cover.
Yeah. And bringing the voices of the needs of children, even to the level of having policies being done, is excellent. And I must tell you that before I leave the country, I'm so proud of is that recently the Parliament has endorsed the child protection law and the child rights law. And this is something that World Vision, along with all its partners and the government, has been working for almost 4 years. Personally, I been working on this, and this is really something.
Why these laws are so important?
Because I think it really outlays the importance of the issues of protecting children, at the school level, at the family level, because that's where most of the things are happening.
Well, in Mongolia, there are zillions laws, but the problem is its enforcement.
Yes, right.
And how you would think, in that sense, that these laws are enforced in this country. Have you considered that particular idea of enforcement in the law itself?
Well, I think in any country, including Mongolia, the law is one aspect, and I think it takes a lot of energy, a lot of time and effort, and a lot of definitely advocacy, in terms of how we can really get this law passed. But then again, in every context, the implementation is the real success part of it. And sometimes that's always also challenging. So I know that many of the partners, including World Vision, including the ministry and other UN partners, will definitely put a lot of our effort in terms of how these policies became a reality. And I can just give you one example of how the aspect of child protection, one aspect is really being realized. 108, I think you probably know, this is the child helpline. This is something that World Vision, along with the National Authority of Children, as well as Mobicom, a corporation, we started doing this.
That basically means every child, you feel they are in danger, they just take or take her cell phone, dial 108.
That's right.
With the cell phone now, how you would dial it? 1900, then 108, or they have changed something. Just with the 3 digits.
Yes, it's a 3-digit. It's a free, toll-free.
No, from your cell phone, you just put 3 digits and you call and say that you are being kind of bit or something.
Yes. Well, actually, since the start of this child helpline, sometime in June 2014, I think today we've got more than 278,000 calls that have come in to the child helpline. And this child helpline is something...
Hang on. You said...
278,000.
No, it's just about 1.5 a
Yes.
year. Less than 1 a year, or 1.5 a year.
Yes, 1.5 years.
You got a 278,000
calls.
How violent is the society?
Well, let me clarify that. Well, even though we did talk about the numbers of 278,000, not all of those calls are telling me.
Understand?
Yeah, saying I'm being abused or I'm having
Plus
a problem.
a lot of fake calls. So when you
not fake calls.
Filter the statistics,
Yes.
what is the real serious?
I would say close to 40% of those numbers of calls probably are people calling and saying that they're having some challenges probably at home or school, or I wouldn't say really abuse cases, but really child protection issues.
Then what was the reaction on your side?
From our side, actually,
I mean, 108 belongs now to whom?
Actually, it's been monitored by the National Authority of Children.
National Authority of Children. So what they have been doing with this 40% of serious?
Well, what they do is when these calls come, they take down, and then they are immediately working with a multidisciplinary team to see how some of those calls can be really acted upon. And I think.
But first of all, you check it, no?
Well, again, it's the National Authority of Children that are having this data. We do have access to the data, but I don't think World Vision, should be directly involved in.
I understand. Now, this 108 operated by or supported by Mobicom?
No, World Vision and Mobicom started this. Now the running of this 108 is now with National Authority of Children.
And plus all operators help them probably.
Yes.
They can call from any call.
Yes, they have their own operators.
So we at least have some saving line for those children who are in danger.
True.
That's important already. True. Compared with other countries, are we late? Are we efficient, sufficient?
Well, I'm really proud to tell you that Mongolia is probably one of those countries that's got this child helpline. And I did say this to many of the our partners, even to the ministry officials that I've been talking to, say that there are many countries even probably in Asia Pacific that do not have something like that. And yet the number of abuses and others are such high. And to see Mongolia have this child helpline is definitely an issue when I talk to you about child protection, which is a success for child protection.
This child protection and children right law, are they common in this part of the world or in the world in general?
Well, Mongolia has gone one step further in making them a law, but definitely other countries do recognize and know that these are issues that's happening. And,
are they this law in
and they
China,
have their
Russia?
Own, yes, they have their own mechanisms how they deal with that. Now coming back to the numbers that I talked to you about, as an organization that helped in the start of the child helpline, I don't think we are just going to be glorying in the numbers.
Correct.
What is a true success will be is when a child calls, how is the needs of the children or the child particularly taken care of? So we at the moment currently are working with the National Authority of Children as well as with Mobicom and other partners to see how we'd increase more lines, number one. Number two is also to see how we can have a very strong multidisciplinary team so that every child who calls can be acted upon. Only then can this 108...
How big this 108 line, how many children can call at the same time?
I think they've got about close to 6 or 10 operators.
Operators.
Yes, and over the day, there's lots of those calls. I think if I really remember the average, something around 400 or 500 calls or something like that.
Okay, then let's compare this level of calls with other violence upon children in other countries. How violent is Mongolian society, you think?
First of all, I don't think I have statistics of other countries, because I did tell you that, the whole issue of 108 like we have in Mongolia is not available in many countries. So some of the numbers that probably may be coming from those countries probably may not be the true picture too, in terms of that.
Because they have not the opportunity to have this statistics.
But at the same time, before the child helpline, some of the situation in Mongolia was probably also the same thing. Some of the numbers were probably not accurate. Today with the child helpline, we are able to at least look at the numbers that's coming.
The issue is now how to
really strengthen that.
How to read these statistics, how they react. Most importantly, how to make sure that this kid doesn't call again.
Sure. And I think for me, the other thing, Jargal, also as a child focus organization is, I know Mongolia celebrates children. I know how much
is it
value.
Particular, you think, a nation value?
Everybody does, but I do see Mongolia kind of, really, celebrating, the life of a child. And for me, when we look at, some of the challenges that we have at the household level, for me, what I would really want to encourage and really see, after I leave in the country and have, a great success would be is how can we really create an environment within the family whereby the child that's being so celebrated also lives in an environment that the child can grow freely.
Don't you find, on the other hand, now the children become, in particular, more well-off families, kind of too much taken care of, and then many of them are kind of not self-sufficient, You know what I mean? This sort of tendency. Do you see that?
Can you tell me again?
The children.
Okay.
From more wealthy families. Mostly we talked about poor families or middle income families. Now back to the attention of, you said, cherishing children. Is there anything that is too much, that the children are staying kind of not independent, just relying on, they all don't care about their material being, etc. Because everything is ready, parents, grandparents, or everything they give, and the child, is behaving like, everything is only for him.
Well, there always needs to be a balance on everything. And when I mentioned that there is definitely a disparity between the rich and the poor, and that gap is widening, definitely there will be situations where you talked about where people having more, and definitely people not having enough. And as an organization, World Vision's mission is more in terms of how the most vulnerable children and the families can really be served. So that's our target group.
What is on the average a year you spend in Mongolia?
Well, I think our budgets per year has been anything ranging from 21 million to 23 million these last few years. And so given just a rough calculation for the last 20 years, we've invested almost more than $400 million.
Yeah, out of this, say a year, 20,000, which percentage administration cost?
Well, administration ranges at different levels. At the national office level, at the headquarters level, so we are looking at something around 16%, 16% that we're trying to bring targets down. But at the same time, I must also do tell you that while we have till the last year been enjoying such good funding, that's been given by our donors, moving forward, we do see a lot of challenges, in our funding, in terms of our projects being funding long term. So World Vision needs to start looking at different funding models in terms of how.
How do you then measure your success?
one of the success is about our indicators. In terms of our strategy, we have our strategy. And with our strategy, there are a lot of indicators that are attached. And then these measurements do come in year after year, do our reporting. We do find out what we've done and how successful we are. And those also help us in terms of how we can focus for the next strategic period.
Okay. You know, I have been meeting you, your people, and now talking to you. I found that there are a lot additional good source of not only money, but also know-how, knowledge, expertise, a lot of research, and not saying about the material equipments, whatever you are bringing. It's a great hand to develop our developing countries' medical care issues, and I see a lot dedicated staff, Mongolians working for you, and that's a great help for Mongolia, and I would like to thank your organization and you for serving for many years in Mongolia. And when I learned about this, what's going on, what are you doing, I decided to invite you before you leave, and so that's why we had this conversation. And thank you very much for sharing your very much insights before you leave, and I hope it is this great legacy, and I think your next predecessor will continue.
Thank you, John.
Thank you, Vincent.
Thank you, John.
Thank you. Good luck, sir.
Thank you.
Okay. За хүн төлөөлөгчтэй өнөөдөр манай дефакто нэвтрүүлгийн зочноор Дэлхийн Зөн, тийм ээ, Дэлхийн Зөн Монголын байгууллагын дарга ноён Vincent Edwards оролцлоо. Их баярлалаа.
Гişэлэг мат.
Those are particularly going into the